The public healthcare system has come under the spotlight recently, with healthcare capacity stretched and workers overwhelmed and dissatisfied. Can the upcoming budget provide meaningful reforms for them? We ask public health expert Dr Farhan Rusli for his thoughts.
We can't expect too much from it. I think one of the key takeaways that we have to note here is that anything that is given through this budget is going to be very short-term and is a stopgap measures that they can do. I think on the pretext of it, a lot of the budget is going to go into medication purchase or pharmaceuticals. It has always been that way. But what improvements can be done if there is actually an increase in the budget, do not increase the amount that you actually give to purchasing of pharmaceuticals, rather spend on the ability for you to prevent disease from occurring. Now, this is something which is really important because there's no point in you buying more medicines, but you're not stopping the disease itself in its tracks. And when you don't stop disease in its tracks, no amount of beds, no amount of hospitals, and no amount of medications is actually going to be enough. At one point, you will have overcrowding, but you're not solving the problem at the base, which is the key point, is stopping the disease from progression.
Amid calls to increase the public healthcare budget to 5% of the GDP, Farhan stressed the role of the health minister in lobbying for immediate and tangible reforms.
A lot of our house officers, medical officers are still sleeping in the pantries. They're still sleeping in changing rooms. They're sleeping on chairs, on plastic chairs. They're eating while they stand. A lot of our Muslim doctors don't pray 5 times a day because they just don't have time, So it's come to that point where I start thinking, at what point do we actually get to push them before they actually break? And I think the breaking point is so close. That's why people are even up to the level whereby they say, you know what? As much as I love being a doctor, I love the patients, I don't mind actually just walking out of my workplace so that I can prove a point telling you that this is something that you need to pay close attention and be very serious with. But like I said, I'm not going to be putting too much hope on the healthcare budget. Everybody will say that they need more money. Now, the onus is who can actually justify where the money is worth to be placed into. And I think this is the key takeaway. I think this is the job of the Minister of Health to actually tell people and to actually tell the cabinet that why is my ministry the priority? Why are my doctors the priority? And if she can actually make the cabinet see the long-term game here, then the budget will come to her. If not, then I guess we're not going to see any meaningful change in the next budget table.